Welcome to the We Level Up Treatment Center video series. In today's video we will discuss difference between bipolar and BPD. The difference between bipolar and BPD can be confusing due to their similarities. Although bipolar disorder and borderline personality disorder, BPD, share similar symptoms, they are two distinct illnesses with various forms of therapy. At first glance, it is easy to mistake BPD versus bipolar disorders, but the two have distinct differences. Although they can have similar symptoms, bipolar disorder and borderline personality disorder, BPD, are two distinct mental health diseases that need to be treated differently. While both disorders involve mood swings, bipolar disorder consists of more distinct periods of mania and depression, while BPD is a continuous cycle of unstable moods. Additionally, while bipolar disorder can cause impulsive behaviors, in people with BPD impulsivity is more likely to involve self-destructive behaviors. The primary difference between bipolar and BPD is that bipolar disorder involves manic depression with extreme highs and lows. At the same time, someone with BPD feels intense emotional pain, a void filled with hopelessness, fury, and loneliness. Among the difference between bipolar and BPD are the distinguishing traits of each disorder. Read on for more on the difference between bipolar and BPD disorders. Bipolar disorder is an episodic condition that includes periods of mania or hypomania and depression. It is a mood disorder in which the individual experiences dramatic shifts in mood, energy, and activity levels. These changes can last for days or even weeks at a time. Bipolar disorder is an affective or mood disorder involving extreme shifts in mood, energy, activity levels, and the ability to carry out daily tasks. In contrast, BPD is not an episodic illness but an enduring instability in interpersonal relationships, self-image, and emotion regulation that lasts over time. Bipolar disorder symptoms. During times of mania, symptoms might include an excessively happy or angry, irritated mood, more physical and mental energy and activity than normal, racing thoughts and ideas, talking more and faster, making big plans, risk-taking, impulsiveness, substance abuse, sex, spending, etc. Less sleep, but no feeling of being tired. Poor judgment. During periods of depression, symptoms might include drop in energy, lasting sadness, less activity and energy, restlessness and irritability, problems concentrating and making decisions, worry and anxiety, no interest in favorite activities, feelings of guilt and hopelessness, suicidal thoughts, change in appetite or sleep patterns. Causes of bipolar disorder. Although there is no known etiology for bipolar illness, a number of factors, including biological differences, bipolar disorder patients seem to experience physical brain alterations. Although the importance of these changes is not yet clear, they may eventually point to their root causes. Genetics. Those who have a first-degree family with the disorder, such as a sibling or parent, are more likely to experience bipolar disorder. Researchers are looking for genes that might contribute to the development of bipolar disorder. Risk factors of bipolar disorder. The risk of developing bipolar disorder and triggers for the first episode include the following factors. Having a first-degree relative, such as a parent or sibling, with bipolar disorder. Periods of high stress, such as the death of a loved one or other traumatic event. Drug or alcohol abuse. Complications from bipolar disorder. Bipolar disorder can cause major issues that impact all aspects of your life if it is not treated, including issues related to drug and alcohol use, suicide or suicide attempts, legal or financial problems, damaged relationships, poor work or school performance, borderline personality disorder. Contrary to distinct episodes of mania or depression in people with bipolar disorder, borderline personality disorder involves a long-term pattern of abrupt, moment-to-moment swings in mood, relationships, self-image, and behavior that are typically brought on by conflicts in interpersonal interactions. When confronted with distressing life circumstances, people with borderline personality disorder may react excessively emotionally and frequently attempt self-harm. Typically, their interactions with people are tumultuous. People with borderline personality disorder are also more likely to have other mental health problems. Despite the fact that trauma does not cause borderline personality disorder, they are also more likely than persons with bipolar illness to have had some form of childhood trauma. They can often have problems with addictions, eating disorders, body image, and anxiety. Symptoms. A person with a borderline personality disorder has trouble controlling their thoughts and feelings and often has impulsive and reckless behavior. Here are the condition's main symptoms. Frantic efforts to avoid feeling abandoned. History of unstable, intense relationships. Feelings of emptiness. Poor self-image. Impulsiveness. Spending, sex, substance abuse, etc. Paranoia. Self-harm, e.g., cutting, or suicidal behavior. Mood swings involving melancholy and fury, typically brought on by tense situations or connections. Tendency to see everything as either all nice or all negative, depending on the situation. Problems managing anger and unpleasant emotions. Treatment. Most borderline personality disorder sufferers require long-term therapy. In order to help people manage impulses, such as suicidal urges or tendencies to self-harm when they feel upset, feelings of distress or anger, and emotional sensitivity to interactions with other people, treatment typically entails specific forms of psychotherapy, such as dialectical behavior therapy, DBT, or transference-focused psychotherapy, TFP. Although they are not always helpful and are not thought to be the main focus of treatment for borderline personality disorder, medications are also occasionally used to aid with these symptoms. Short hospital stays are occasionally required to handle emergency situations with risks to safety and well-being. Can you have bipolar and BPD disorders? Bipolar disorder and BPD are both treatable conditions. While BPD can have symptoms that look like the symptoms of bipolar disorder, they are considered two separate conditions. It is crucial to remember that BPD and bipolar disease can both result in symptoms including mood swings and trouble controlling emotions. This can make it difficult to diagnose which disorder a person may have. There are a few key differences between bipolar disorder and BPD. One is that mood swings in bipolar disorder can be unpredictable, while the mood swings that come with BPD follow a cyclical pattern. Additionally, symptoms of BPD are typically more extreme than those of bipolar disorder and may be harder to control. An accurate diagnosis from a qualified medical professional is essential for the best treatment. We Level Up Treatment Center Florida provides world-class care with round-the-clock medical professionals available to help you cope. In addition, we work as an integrated team providing information about the difference between borderline personality disorder and bipolar disorder and other aspects of treatment. Make this your opportunity to reclaim your life. Call today to speak with one of our treatment specialists. Our specialists know what you are going through and will answer any of your questions. Your call is private and confidential, and there is never any obligation. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.